I think.
Yeah.
Good to go. Excellent.
Fab. Here we are.
Here we are. Hi everyone, and welcome to Stephen and my workshop on working with frontline staff and understanding Chem Sex in Scotland and the Chem Sex community. My name is Lesley Bonn. I work for Scottish Drugs Forum. I'm a National Training and Development Officer, and I work within the sexual health, bloodborne virus and harm reduction team. Stephen, over to you.
Hi everybody, I'm Stephen. I work for 10 and Seconds Trust. I'm a health promotion specialist for the Lanarkshire area for GBMSM and the LGBTI communities. Hello.
Cool. So bear with us as we just get used to this little system here. There we go. So what are we going to and what are we hoping to cover in today's workshop? I will start us off with sharing some information and research that Scottish Drugs Forum have conducted over the last couple of years, looking at the training needs and support needs of both the community involved in Chem Sex in Scotland and also staff that might be supporting people involved in Chem Sex as well. Then Stephen will take us through what the training that Stephen and I deliver to frontline staff working in services in Scotland, all around Chem Sex in Scotland. Then we've got a couple of questions that we would love to ask you, people participating in this workshop, so that we get a bit of a dialogue going to see what is going on around services and knowledge and support for people accessing services in Scotland. And finally, Stephen is going to finish up the workshop looking at, from our perspective as well as your perspective, what else needs to be done in Scotland to ensure that people who either need information around Chem Sex or need support around Chem Sex in Scotland have the information and support that they need. Okay. But firstly, over to Stephen, who is going to just give us a little definition for those that might not be aware.
Hi everybody. So the definition, we don't want to get too in depth with this because the Chem Sex has been mentioned quite a bit in during the conference. So just a brief, in a nutshell, the definition of Chem Sex: using drugs when having sex. It's most commonly among gay and bisexual men. There are typically 3 specific drugs, chems, that are involved. So methamphetamines, methadone, GHB and GBL. That's what most the researchers point towards, that most gay men are using for chems. But in Scotland, we noticed through the research that Ken's going to the research that Lesley's going to be talking about, is there's cocaine in Scotland is another one that's been used. So these drugs can make people feel less inhibited and increase pleasure. So with the both of them combined, it can create an environment for maybe extreme behaviour, for situations that people might feel a bit uncomfortable in, or that might create some issues. So this is really what we're going to be talking about for this presentation. And as well, just to mention, so you've got the Q&A for the questions part. If you want to ask a question during, then just please put in to the question section. As well, if you want to raise your hand, there's a point that you want to make, then just raise your hand and we can bring you in to the speaker section, and it will only be the 3 of us that can have the conversation. You just ignore everybody else that's in the conference. No, I'm joking. So I'll pass it back to Lesley.
Thanks, Stephen. And yet this is a workshop, so we would love a dialogue to go both ways. We know that some people, if you're watching, might not feel maybe necessarily safe or comfortable to do that. Our last slide today will have both Stephen and I's contact details. So if there were points that we'd love to make during this workshop, please feel free to get in touch with us and we can continue the conversations after today as well. So let's move forward. There we go. So training needs of community and staff. So in 2018, Scottish Drugs Forum, we received some funding to undertake research to look at the sexual health and bloodborne virus support needs and also training needs of the workforce as well, around 3 populations that were considered maybe not as well known. And the 3 populations were people who use steroids and other image and performance enhancing drugs, people involved in transactional sex, so the selling or exchanging of sex for money or other goods, who also use drugs as well. And then the third community that we looked to do interviews with where was the men who have sex with men who engage in chem sex. So we did qualitative interviews with those three populations, and we also ran focus groups as well of staff working in services to find out what their knowledge was, what their confidence was in terms of providing support and information for these populations. So going forward over the next couple of slides, we're just going to share some quotes with you and some of the key findings in two areas of the research from the chemsex population. So let's have a little look at this. So this first quote is all around using drugs and being within a chemsex environment. So I'm just going to read the quote out to you. Yeah, getting them through the apps was really common. So the apps being talked about here would be maybe Grinder or Squirt, for example. And then we'd start using that. Maybe other people that's with us, they'd have the bit that they'd come with, and then inevitably, whatever you think is going to be enough never is. And you then start to run out. So then you'd be onto the app to get more, and people would just bring it in. So that quote there is just really showcasing that there's generally and often more than there's a group setting involved. Everyone is potentially bringing their own substances. People are maybe not knowing what those substances specifically are. Generally, the substances are going to be getting used within these environments as well. And it is very, very easy to source additional drugs using the apps and additional people to come to the environments and the chemsex events themselves. In terms of key findings from this part of our report in terms of using drugs and access to drugs and knowledge about drugs, we did find that there was a lack of awareness from people involved in chemsex around safe and appropriate dosing of the substances that they were using. And also that they mentioned themselves that their rational decision making was adversely affected from both the effects of the drugs that they were using and also the length of time that they were involved in the session as well. So they might start off a session knowing what they're having set boundaries and knowing what they will and will not do, but during and under the influence of the substances that they are on and during the chemsex sessions themselves, they will engage in risks that they wouldn't necessarily be involved with. People also were requesting and said it would be useful if there was guidance on how to use drugs safer to reduce harms, with the usual caveats that there's always potential for harm when using substances. So that would be for each administration of the substances or chems being used, and the dosing and how to dose and how to over what period of time. Yeah. Stephen, anything to add in there?
No, I think it's what you've mentioned about the lack of awareness and safe, like appropriate dosing, is something that is really important to bring out of the research, so that when frontline workers are getting informed about it, that there is things that can really help chemsex users be safe within the environment.
Thanks, Stephen. So moving on to the next quote from the research. I didn't always feel comfortable bringing it up because I felt there was a bit of judgment there. If I'm being completely honest, I mean, yeah, I've never felt that I could, that it's being brought up in this. I didn't feel like it was a safe environment to talk. I felt it was more the finger was getting pointed. And we come across in the training that Stephen and I facilitate, this is one of the biggest aspects for us around people coming on our training. How do we ensure that people feel safe and not judged when accessing our services, when maybe it's an issue that they struggle with and they've felt judged in other aspects of their lives as well? So key recommendations around services and how to create safer and more welcoming environments for people. So definitely staff must be aware of potential that clients might feel that shame, embarrassment, and fear of being judged if they are seeking information and support around chemsex. Consideration for services and staff around what questions they ask and how they ask those questions, what language that they're using, and also informing clients, but potentially even that the staff themselves understands the rationale around why they're asking those questions, and they're able to do that in a way that is informed and isn't shrouded in judgment and fear, and maybe even a bit of embarrassment from the staff members themselves that they don't feel informed. Also, the substances that we were talking about here, methamphetamine, methadone, GHB, GBL, they come with their own potentially long-lasting effects on clients as well. And one of those could be paranoia that can cause difficulties in one, the client coming forward and being open and honest in a service, but also the perceptions from staff as well around what might be causing this. So I think lots for staff to consider in terms of how informed we are and how might we respond if someone is coming to us, especially in a drug service that might not necessarily have the specialty the specialism around supporting people involved in chem sex. Stephen, any other points there that I've potentially missed?
No, not at all, no.
Thanks. Stephen and I are just going to check in with each other, I think, first time that we're running this workshop. So just a little bit of other research that SDF has just released last month. Well, I say research, really it's the findings from a learning needs assessment that we put out earlier in the summer. We asked just quite simple questions on how staff were feeling in terms of their confidence and their knowledge and a range of issues. And we received 287 responses from all across Scotland. And I think the findings here show that there is definite work to be done across the workforce in Scotland to raise the information and knowledge that staff have, and also the confidence that they have in engaging and talking around certain aspects in terms of chemsex. So here we've got 13% felt informed around the sexual health and bloodborne virus needs of people involved in chemsex. So that's really, really low. So definite work for Stephen and I, and hopefully others, to help us along the way to increase knowledge around these issues. 37% felt confident to ask people about the sex that they had. 47% felt confident asking people around their sexual orientation or gender identity. But then that decreased when it came to offering support for people that might need that support, down to 32%. So people might feel confident to ask, but not necessarily everyone then feels confident to support someone around any potential disclosure or need in terms of support. And we have a slightly higher rate of people feeling confident around their injecting practice and other drug use. And that might just be because we had a slightly higher rate of responses from people working within drug services. I would love to explore that question further in terms of how staff feel confident, and is that around heroin injection, and do staff actually feel confident to ask people and to provide advice around more stimulant style drugs that would be used within a chemsex environment. So that would be the crystal meth, methadone, and cocaine as well that we're seeing. Okay. Stephen, any final thoughts from you?
I like seeing these percentages because I work within sexual health, so chemsex is something I talk about quite a lot. So it's good to see that there is still work to be done. I like seeing these, even though these percentages, I wish they were a bit higher, but it's good to kind of bring me out of maybe a little bubble that I could be in sometimes, where I'm thinking I'm doing all the work, but it's good to kind of see that more's needed to be done.
You're not out of a job yet, you mean?
Not yet, not at all.
Okay, I'm now going to stop talking for a little bit and pass over to Stephen, and Stephen is going to take us through the training that we've created and that we have been delivering for the last year and a bit. Thanks,
Hi,
Stephen.
everybody. So talking about the training that Lesley and I offer, with the research that Lesley was talking about there, the SDF got together a kind of training on Chem Sex for frontline workers, and I attended, and there was great back and forth between us both. Really good experience, really good experiences were being shared, and by the end of the kind of the training, we realised that maybe doing something together would be really a benefit. So we put our heads together and come up with the Chem Sex in Scotland. Obviously, because of COVID, it's on Zoom, so it's about 3 hours long. It's at an introductory level for staff, so that people can at any level can come into it and feel that they're getting informed, or even just a kind of refresher course. As well, it runs near monthly, which is good because there's been a lot of uptake in it. So we've been able to kind of put the diary out quite in advance to get it filled up, which has been great for us. So, as Lesley mentioned and myself, that it's co-facilitated between us both, SDF and 10 Seconds Trust. So we brought experiences from both charities and work together to create something. So partnership work is something that's really helpful in something like Chem Sex, because it's a very complex issue. So it's, as I mentioned, it's aimed at frontline workers, but especially those who work in sexual health, drug services, LGBTIQ plus, and mental health services. But again, anybody could come on and get a kind of an understanding of it. So the learning outcomes. So we describe the context of Chem Sex in Scotland. So as I mentioned earlier on in the definition, the different types of drugs that are used. But in Scotland, cocaine was another one that was used. So we reflected on how individual attitudes and beliefs can impact on clients and the services that they receive. So it was we asked the participants to ask themselves how they feel about Chem Sex. Is there anything that's coming up? How do they feel about it? If it's something that's positive or negative, we really try to explore that as well and ask the question: is that helping the service that you're providing to clients that are coming forward and maybe asking for help? So we try to make it as much of a conversation as possible during it. So we explored ways of engaging clients and discussing Chem Sex. So we used things like breakout rooms to make sure that, again, that we weren't looking in on people. There wasn't like me and Lesley were watching what people were saying. The breakout rooms were really important to kind of foster discussion in Chem Sex, to give people the space to go away themselves and think about it, and then come back with kind of group answers. And identify key strategies to reduce harm in those who participate in Chem Sex. So harm reduction techniques like understanding about different kinds of colour-coded syringes, for instance, and knowing that if people are going to a Chem Sex party, that they can get a colour and their syringe will be red, for instance, and they wear a red band, and the frontline workers knew where to signpost for that. As well, about dosing, which was mentioned, to make sure that there's information that you can give for clients who maybe want to engage in Chem Sex. So go to next slide. And so this is our Chem Sex in Scotland for the next couple of months. So our first few Chem Sex training sessions were all fully booked, which was great. And the next ones that we've got up till December, there's, I think Lesley mentioned before, there's like 3 spaces. Is that right? I think
3 spaces in December.
So if anybody wants to come on, then get in touch with us, because they fill those spaces up. We're really keen to make sure that the services is getting used. So the courses, what we'd kind of talk about, as mentioned, like what is Chem Sex, the main drugs and the effects of these drugs, and discussion groups. So as I said, the breakout rooms, talking about the harms that can be experienced, the motivations that are the driving force behind people using Chem Sex. So again, fostering a lot of discussion. So the anonymous poll questions to reflect on if they've witnessed homophobia in their personal lives and in their work, followed by a discussion on the impacts of homophobia. So I'll talk about this further on in our presentation about why we would bring homophobia into something like chemsex. But the anonymous polls really helped foster the discussion, because people, again, might have felt uncomfortable to answer specific questions about sex or drugs. So keeping it anonymised helped keep the flow of conversation going as a way of, just making the discussion more easy for the participants. So we mentioned case studies. We talked about them, again, bringing up discussion. It was just Lesley and I's point to kind of put in things to talk about in it, to get people to think about it. So we identified like ways to reduce harm, as I mentioned, exploring what else may be going on for people. So like safer injecting packs, a young person entered in the scene. So that was one of the case studies. So we talked about what would be the information we would give to a young person who is newly out on the scene. They're just come out like a month before, and they're going out to the scene, and they've been introduced to chemsex. What information could be given, as well. Someone reaching crisis point was another one. How this person woke up from a party, realised that he took crystal meth for the first time. He realised when he looked at his bank statements that he's transferred a lot of money. He was late for his job because the party lasted for the full weekend, and how he was taking cocaine to kind of have enough energy to go out and go back to work. So we were fostering a conversation around that to really ask themselves and what their services could do in that situation if a client came up and talked about that. So, and as well, looking at making referrals for chemsex and asking questions. So referrals, as I said, that there's not really something specific in Scotland as of yet, but making sure that people know the signposting to either Lesley or myself or the other amazing services that are available in Scotland, so that the client can feel that they're getting the help that they're asking for. Is there, I think, anything else I missed? Is there anything else I missed? No. There we go on then. So the reflections that came back from the participants. So what we were finding, people were asking about chemsex jargon, like why use the jargon? What's the point in using jargon? Like for instance, slamming instead of injecting. Why would you not just use injecting? Because we found that clients didn't really engage or relate to the word injecting. They didn't identify with it. They identified with slamming. It's slamming that I do. I don't inject drugs. I slam. And when using these kind of jargon words, these words that are specific to the chemsex environment, made the client feel more comfortable to talk about it openly and honestly, but without the kind of fear of judgment. If the frontline worker understood this kind of jargon, then maybe they would understand the chemsex environment, and that would help the conversation between the both of them flow well. And we were being asked, is it just gay men or is it wider? Is it everyone? So the training that we provide, the awareness that we provide, is for GB MSM. That's not to say that people don't take drugs and have sex within the straight community as well. I've tried to find out information and maybe some research around that, but there doesn't seem to be that much. But just knowing, in my own experience, being out and knowing that the straight people do take drugs, so it might be something that's happening for them. But this training was specific to GB MSM. So as well, I've been asked about the scene. So is the scene, is that something that's part and parcel of the scene? For instance, taking drugs, is that something that is expected on the scene? So we were having discussions about understanding the scene of how open and free it is, but as well as finding out who you are as a gay man. Like coming out is like the first step. It was Eddie Izzard that said that, of finding out who you are, and then you can step into the gay scene where there's the very extreme behaviours. There's a lot of very extreme behaviours and a lot of substances that can make you maybe do things that you might not have expected from yourself. So it's talking about the scene in a more general way, that there's benefits for going on it, for finding out who you are, friendships, socialisation. So it's a great place to experience you as an out queer person, but as well mentioning that there can be risks involved with it. So getting frontline workers to feel comfortable and understanding the scene was something that was coming up. So as I mentioned, homophobia, why we would talk about homophobia and internalized shame, and something is like chem sex. So it was coming up that clients were using chems as a way to free themselves. There was a few quotes that were saying things like it was making them feel free. It was making them feel that they were standing outside in the sunlight. And I found that quite interesting. And it was going back to, well, what is it that they feel without the chems? What is it they're feeling when they're engaging in sex without chems? And homophobia was something that was coming up, and internalized shame was something else that was. So we were having conversations with the practitioners about these two things that may be a reason for why people will use chems as a way to kind of get over the homophobia that's getting brought into the bedroom, get over the internalized shame that's getting brought into the bedroom, so that they can have the sex that they've kind of always wanted to have. So asking, are drug services set up to support people with problematic use of chems? So we were all asking the question, well, what services are set up? If there was, getting details, doing a bit of networking as well, making sure that our participants could get details very easily if they did have a client and they didn't really know how to support them. Understanding about sober sex as well. So within the scene, some people their first experience with having sex may be on drink. It might even be on drugs. So understanding about sober sex, how sober sex is something that everyone is capable of doing, but why is it that people are choosing to use chems to have sex, whereas just having sober sex? So for instance, chems can disassociate, as I mentioned, from homophobia and internalized shame. That can kind of get over that hurdle and reach the sex that they're wanting to have. So our services set up to facilitate information on sober sex, on sex that is without sex that's without drugs, talking about sex as a healthy part of being human. Is this something that services are set up with? And understanding the differences of problematic and unproblematic uses. So there was one case study that we had where it was a couple that they would buy a bag of Coke at the end of the month and have sex with it, and they enjoyed themselves. They didn't go to chem sex parties. They weren't really into that, but they enjoyed having a bit of Coke with each other. So understanding that might not be as much risk as someone who's engaging in chem sex maybe all the time. So differentiating the both of them, but as well asking in that particular scenario, is sober sex something that you find maybe difficult? So again, it's always being aware of what questions were right to ask for any kind of specific area. So next slide. Oh wait a minute, I've got there's a couple of questions here and the Q&A. So what Alan was saying, I think is a really good point, Lesley, about unpicking exactly where drug workers are confident and maybe not so confident in having those conversations. So that's another one here. So this point on services set up to support people with problematic use of chems. There's a good community exploring relationships and leads about this. Sorry if I've missed you saying that. No, that's great to know. This is what's part of this, why we love doing this, is there's a lot of services that I'm not aware of. I try my best to be made aware of them, but sometimes I don't know a lot of them. So that's great that you mentioned that. Thanks very much. So is there anything else on the reflections, Lesley, that you might have not wanted to touch on? Or no? Okay, great. So for the evaluations, so this is some of the things that people were saying about our sessions. So I found Lesley and Stephen really approachable and well informed on the subject matter. The conversational approach meant that people were able to discuss their own views and experiences more, so that if the training was delivered predominantly via PowerPoint. So that feeds back into the discussion point of it. Is me and Lesley were putting in just, well, what do you think of this? Go ahead and discuss, and then bringing it all back at the end. I particularly like the informal but informed and informative approach. So again, we liked the informal part. We made the conscious choice to keep it as informal as possible. is a way for frontline workers to easily access the information. We didn't want to get bogged down too much in academic jargon with it, which is part of the amazing research that's going on in Chem Sex, but just make it more accessible for people. The open discussions and clear explanations in culture and language related to Chem Sex, so that relates back to even though not making the training be too jargonistic, but making sure that the staff, the frontline staff, are aware of Chem Sex jargon to use for frontline, to use for clients, potential clients. So next slide. So we're going to just ask a couple of questions. We're going to stop the PowerPoint. I'm going to pass it back over to Lesley.
Thank you, Stephen. So this is where we might just have a little bit of awkward quietness, but we're really hoping that you guys might engage with us using the chat or the Q&A function here. So first up, we have some questions that we would love to ask you, and we know that not everyone is really comfortable. If this was a workshop and we were face to face, we would be popping people into groups to discuss these questions and then hopefully getting someone to nominate themselves to feed us back later on. But at the moment, we have to use the chat function to do this. So we will try and facilitate this the best that we can. So the first question that we wanted to ask, and I don't know, Becky, are you there just to raise it? So if you do feel confident and comfortable to write in the chat section there, or raise your hand if that's okay as well. We can see that a few people have engaged already. But what services currently exist in Scotland to support people involved in chemsex? Do people have examples of services that currently exist? That we would love to hear about those. We know about some of them that we will talk about later, but if you've got experience of any service at all, we would love to hear from you. Stephen, do you want to talk with me at the moment? Because we just might not have any.
We might not have any people come up, which is okay.
That's okay.
Yeah, we'll be going into we'll begin into some of the services that are available in Scotland and in the wider UK in a couple of the slides. But just pop your any kind of answer that you're wanting, even if you don't know. That's good to know. That's a good thing for us to know, that if you guys don't know about it.
We've got one there from, I think that's Lewis. Is it Lewis Clark? Hi, Lewis. Talking about the obvious one, which is SX from Waverley Care. Yeah.
Yeah, definitely. That's what we may as well say that's what some of the slides are on. So.
So that is a service that's based in NHS in partnership with NHS Lothian, and they do fantastic work providing information and support as well. Oh, we've got Alan asking a question here. Has anything come out in conversations during training about the effects of the pandemic on chemsex behaviour and people presenting in need of support? Thank you, Alan, for asking that question. I think it was quite a strange time, wasn't it, when we were delivering training, especially during lockdown, but we knew that there was events going on and there was questions of what do you do during COVID, but people also needed connection during that time as well. And if you're single or you need, it's a very loaded question. I don't know if there's any research, but we've definitely had conversations around it. So the information would be all anecdotal. Stephen, how about yourself?
Yeah, thanks, Alan, for the question. I would second what Lesley said about it being anecdotal. It's just really what I've experienced on like when I'm doing online outreach on like Grindr or Scruff. So like what behaviours of people have been on these apps, and I've seen people advertising that there's parties available. So the pandemic hasn't really stopped. It may have changed it. It might have changed the way that people access it, because it's become more of it became more of a, rather than it being a party after like a nightclub, it was just you would go to someone's house. So the kind of scene is being cut out because obviously it's been closed. So again, if there's going to be research about that, that'll probably come out further down the line. But it's just been a bit of anecdotal information.
Thank you. So I've just popped another question there up, and it is, what do we think is needed for frontline staff and non-specialised services in terms of knowledge and skills to support people in terms of chem sex? I think in Scotland we live in a fairly, in, as opposed to England where there's very large cities and there's really, really specialist services that do exist. In Scotland we have maybe concentrated in the Central Belt, specifically Glasgow and Edinburgh. We have a large, a larger probably population involved in chemsex and those, and we have services that are catered to the needs of gay and bisexual men. But maybe elsewhere in Scotland, we don't necessarily have services catering to support people involved in chemsex, and it might be more general services that do exist. So I suppose what we wanted to just explore as well is in more generalised drug services or sexual health services or mental health services, what is needed in order to ensure that people have knowledge and also are supported as well. I wonder if anyone's got any thoughts on this. Stephen, do you want to kick us off?
So it's like thinking of what's needed for frontline staffs for Scotland. I always bang on about partnership work and signposting at the moment, because as Lesley mentioned, there's not really specific to chemsex. There's specific support to chemsex in Scotland at the moment. So just now, making sure that anybody who's in your work or with the frontline staff are aware of signposting, and making sure that if they're wanting to maybe do some work on chemsex, you're not feeling that you have to reinvent the wheel. You can reach out to someone like we did SDF and THT to come together and create something new. You don't have to do it in isolation. You can feel that you can reach out and get support from different charities as well, until there's something that's much more specific that we could pass our clients over to.
Thanks, Stephen. And there we've got Adrian coming in as well and just saying that we need to make sure services are easily accessed by LGBTQI plus people generally. And I think that that's a really good point, and it is something that we do touch on within our training. And we do ask people that come in our training to reflect on what signs are shown to members of the community that this is a safe space for you to raise issues, ask questions, and seek support. Do you have information on your website about LGBTQI plus populations? Do you have information about chemsex on your website? Do you have signs up, and do you have rainbow flags, or do you have signs up that say that to let people know that it is a safe space for them? And how do we ensure that people know that it is a safe space for them? Stephen, what do you think on that?
Yeah, I think it's something that needs to be kind of looked at, especially for GBMSM. So I was speaking to I run a clinic in Campus Lang for fast test. Just a wee plug there, just saying. And one of the clients that came in, the service users, was he felt uncomfortable because it wasn't specific to gay men, and I found that strange. I found that something that was. And I didn't think I would hear that, but it shows that within the community there's different ways that people will be feeling comfortable. So it's a difficult task for services to kind of do a one size fits all for it, but it's definitely something that should be aimed towards. And it's about asking questions, getting people's opinions, getting clients' opinions, getting service users' opinions on what the service should look like for the users.
Yeah, and Adrian's come in again and just saying, as part of our assessment, we need to be asking clients who clients have sex with. So, and it's a point that I know Adrian has worked on to try and improve for our entire time that we've been working together at Scottish Drugs Forum, and that is how do we ensure that services that provide service for sexual health ask questions about drug use, and vice versa. How do we ensure that drug services ask those questions about sex as well? Because drugs and sex, they do go hand in hand with each other, and it leads to some similar risks in terms of bloodborne viruses, and if people are under the influence as well, there might be more risk taking involved, including having sex that you might not be okay with if you weren't under certain substances. So there's definite connections, and we can definitely be improving the way that we ask questions. Um,
Mhm.
there we go. Alan just coming in now.
Mhm.
And I guess though people from rural areas may travel to metropolitan areas to engage in chemsex, they may need to seek support closer to home, and therefore services across the country need to be easily accessible and informed. Thank you, Alan. And that's a point that I did actually make at the Roundtable 2 discussion on chemsex on Tuesday. And because we talk quite a lot in Scotland that maybe a lot of the chemsex activity potentially doesn't take place within Scotland. Do people travel to larger cities? Are they travelling to Manchester, London, Brighton,
Mhm.
Berlin, Amsterdam to engage in chemsex? That
Mhm.
doesn't mean then that the information that they need or the support that they need won't be from where they actually live, and that could be anywhere within Scotland. So
Mhm.
all services, I think, one, need to be aware of chemsex, and they definitely need to be informed. And I think staff need to be given the time to reflect on the attitudes and beliefs in terms of the different sex that people have and the different drugs that people take as well.
Mhm. Yeah.
Stephen, what thoughts do you have there?
Yeah, I think what Alan's saying about it should be easily accessible and everyone definitely should be informed. And it's people are the narrative of queer people is coming out and going to the city. So that's like a narrative that's well known and well established. Like you go to the city to experience your queerness, and because that's where the scene is, that's where the
Mm,
information is, and it's about how do we kind of challenge that to an extent, not to take it away. It's not about breaking it and saying, well, just you can stay wherever you want to stay and get the information. It's about how could we find a balance of well, the your queer life may be in the city, but the information is accessible in your local health centre. Like you don't,
absolutely.
it's not something that you need to feel again about shame. There's like shame involved in rural areas about being gay, internalized homophobia that can be really compounded when you're in the rural area. Then you move to the city to kind of feel again free or escape it. But it's to try and show that queer people can access the services, and that's what we've been talking about. Like, letting frontline staff understand that their people have sex different ways, and that's okay. People will use drugs. Some people will be okay with that. Some people there might be issues. Understanding the jargon, understanding their own maybe biases to it, and to know that that's all right, but to put not to put them aside so that they can really treat the person in front of them rather
Mhm.
as an individual rather than as what they're thinking in their head.
And it reminds me a lot of one time when we did the anonymous poll questions and we were talking about the results. And we had people that lived in Glasgow saying, we asked the question, is Scotland a homophobic country? And we had people in Glasgow saying, no, it's great. You know, me and my partner, we feel safe. We've got people we can go, places that we can go to. And then we had people up in rural Highlands saying, well, wait a minute, that is not our experience whatsoever. We have friends that don't feel safe walking down the street, can't be out with their partners. So where we are within the country, and there'll be parts of Glasgow and the larger cities as well where it's not safe for people to still be out. So I thought that was a interesting reflection on how people looked at Scotland as a country based on where we were, and that's all in terms of our own perception of safety and experiences too. And that goes hand in hand with how people access services. Do they feel safe? Do they feel safe to talk about the sex that they have, to talk about the drugs that they use, and who they are as a person, and what can we do as a workforce to make people feel safe to seek out the information and support that they deserve to have.
Mm-hmm.
Any other comments or questions there before we move on? We wish we were in a room with you all, and then we would be able to have see everyone's faces and thank you for the love hearts. So I think what we'll do now, I will just reshare the slides, and I think, Stephen, if you are okay, just to take us through just our final part of our presentation. I think it's this one. I'm just going to have to skip forward again. There we are. That's the right one. See where we're at.
Mm-hmm.
There we go. I did that quite smoothly, landed on the right one. So what else needs to be done? So Stephen, over to you.
Okay, so that's asking the question. That's again, with all the information that we've been gathering from the training, reading different research and figuring out what is that's needing to be done. And that goes to what Alan mentioned about being easily accessible and informed, and as well what Adrian said about access by LGBTIQ plus people in general. Like, so what are the future considerations to make this kind of possible? So as I mentioned in the kind of the Q&A of like accepting and letting go of our own judgment. So understanding that we've all got our own personal attitudes to sex, and that's okay. Some people can be very open with sex, some people are very prudish with sex, and either is okay. It's not to say that one is better than the other. It's just for when you're dealing with someone face to face, is to put that aside and just, it's like have the person-centered approach. For instance, just make the person feel that they are being listened to, that they're being understood, and they're not being judged. So that does take a bit of time for frontline workers to kind of even realise that they've maybe got some sort of opinion that's already formed in their head, and to be able to put that aside. So then it's letting people maybe get some training and like, I don't know, active listening skills, something like that, to give people a bit more awareness on it. So making sure that internalized homophobia and shame is something that's embedded in the treatment of chemsex. So it's not just about treating the sexual health risks or the drug use risks there. It's about the underlying reasons of why people are wanting to use chems to have sex. It could be a shame around sex. It could be that they just don't feel good about themselves. That they might be ashamed of their sexuality or their sexual appetites, for instance. Like the things that they are turned on by might be something that they don't like, and they're using sex to kind of get over. They're using chems to get over it, to have sex with the people that they're wanting to have sex with. Having like a holistic approach. So as I said there, so it's looking at it as a whole thing. It's not just about treating the issues that arise from it. It's about looking at it, looking at the reasons of underneath them, and then hopefully that would give people the ability to make the better choices when they're out on the scene and there's sex everywhere, there's drugs everywhere, there's drink everywhere. They might feel a bit more comfortable to say, no, I don't want to do that, or yes, I want to do that, but in a much more healthier way. Chem sex first aid. So again, it's like getting people to understand the most recent information on chem sex, where to go for if it's again just pointing out it's A&E, send them A&E. People are like, what happens if somebody passes out with too much G? Well, send them to A&E, and they're like, all right, okay. So it's just connecting the dots, because chem sex is so new for a lot of people, and people don't really understand it. They might not know the first thing to do is what you do with there's always an emergency, like phone 999. And then there's different, more complex ways of dealing with that, about knowing how to treat wounds. If the people come to the party and there's like track marks, the people can know how to kind of deal with that, and to if they don't feel comfortable, to go to their doctor and talk about it. So it's just getting people informed. Family support. So knowing that chem sex might not just be affecting the person that's engaging in chem sex, it might be a family or a wider social circle that's been affected by it. So knowing that if someone comes to a service and says, well, my son or my friend is in chem sex and I'm worried about them, knowing that the signposting that's available for them, knowing that there's services for family support, creating family support under the umbrella of chem sex, for instance, so that it's specific if that person comes into your service. Again, signposting, I always keep battering on about that, but I think it's really important. So knowing about that, making our services acceptable for people that use chem. So again, that's mentioning about the jargon, knowing that the frontline staff knowing that what they're probably going to hear might shock them. They might be like, a person might come in and say, I was at a party for 4 days and I had sex with however many guys, I don't really know what happened. And the extreme versions, the extreme sexual behaviours that the frontline staff knows about this. They kind of understand it, so it kind of takes the sting out of it when someone comes in and maybe mentions it to them. So then again, they're not feeling judged. They're recognising the judgments in their head or their perceptions and moving them aside and just dealing with the person in front. So again, with mental health as part of a holistic approach. So making sure that mental health has been addressed as part of chem sex support. So it's not just about dealing with the issues of what can happen with chem sex. So people losing a lot of money or people losing a lot of social support, understanding the reasons why they're doing it. So having the chem sex embedded with the treatment, having mental health embedded with the treatment of chem sex users will kind of help the service user feel that there's something happening in a more positive way. So next slide. So this is just another quote from the SDF research. So I'd like, I would have, it would have been useful to feel you could speak about it and get the right advice. Like, so you could say, yeah, this is something I do, that they, a service, accept that. It's something people do, you know. Whether they like it or not, here's what you can do to be safer in those environments, and here's what we suggest you do and not do, do and do not do. So that feeds into what I was saying about being non-judgmental, getting frontline staff to be aware that what they're going to be dealing with might sound very alien to them, extreme to them, they've never heard it before, and let them know that that's okay, that's all right, and then getting them to move that aside and deal with the person. Well, what support can I give that? I've moved my preconceptions to the side and I'm dealing with the person that's sitting in front of me. So that quote really speaks to that. So future support considerations, this is just more than what we've been talking about. So counselling and mental health support, harm reduction, a more holistic approach. So that's, again, making sure that different services are linking up with each other to provide support as well. There's that word again, signposting, but I'm going to keep battering on about it because it's really important in Scotland at the moment. Podcasts, groups, online support. So during COVID, how you're getting information if the services aren't available. So obviously online. Podcasts are a great resource. There's a few podcasts that are specific for chem sex users and how the chem sex users have been supported. It's an American podcast that's on Apple Podcasting as well as on Kindle, and I'm sure it's on all of them, but it's a very good support service that people can use in their own time as well. They don't feel that they need to go out somewhere. They can just sit and listen to it. Groups, so like 12-step groups, so when it's talking about drug use, addiction may be something that's part of it. So getting people to go to a 12-step group may help give the tools for someone to come out of addiction for themselves to help manage it, and give them a bit more support, a bigger support network within their, if they do have an addiction. So our support at THT and SDF, so again, a plug for us, so making sure that people know that me and Lesley are here. Just take our numbers. If something comes up, you can just give us a call or give us an email. Again, mentioning family support, upskilling existing services, so noticing where your service might not meet the need and say if there's extra training that's needed, if there's extra support that's needed for frontline staff workers. And lastly, just knowing about research into action. So the amazing research that's happening with Chem Sex, because it's brilliant. There's so much out there. If you type in research for Chem Sex and you go into Google, and the documents that come up there are amazing. But it's how is that translating into frontline staff? Is the research going to frontline staff so that they can get a service that's specific to Chem Sex? There's paywalls involved with a lot of them, so a lot of the information that's available, which is very helpful, you can't get it unless they're going to pay for it. That might not help a charity, for instance, that's always looking always looking for extra support in terms of funding. So these are kinds of easy ways that can help get research to the frontline, that can translate from research to frontline staff use. And just making sure that staff are really informed with it and kept up to date. The next slide. So as I mentioned, this about 12-step groups. So this this quote is kind of about that. Talking groups, certainly Chem Sex Anonymous. My worry about that would be it turn into some kind of knocking shop. But I think if something facilitated by someone who understands, hear other people's stories, because those really help. So 12-step groups is about identifying with the person that you're listening to. If you feel that you're not alone within that group, then you can feel that there's hope, there's support. Support networks online due to COVID, so a lot of the 12-step groups have moved online. A lot of the Chem Sex support groups, again, have moved online. And as amazing as this is, the digital versions of it, there's a lot of people really chomping at the bit to get back to face-to-face for these types of groups, because it's the face-to-face interaction fosters the feelings that you're not alone. There is help and hope out there for people that are using kind of Chem Sex. Next slide. So we mentioned in the Q&A about the existing support. So this is some of this that's come up in Scotland. The great work that the Rome team are doing, the SX and the Steve Retson project are doing. They've got amazing websites with information on it. They signpost to each other as well, and there's great support information on each of these kind of websites, that if frontline workers are feeling a bit that they're not really knowledgeable, these great services in Scotland are there for them to give them the information. The resources are available for them. And so it's asking the question, like, what is it that our services, and including SDF and THT in that as well, is what can we do to help clients get the best kind of service if they're coming to our service. And looking at what's happening outside of Scotland is quite helpful. So the Northern, they're doing really good work with the LGBT Foundation and providing support. It's called Reach, that's specific to Chem Sex. It's specific to people that are engaging Chem Sex within the Northern area. And again, it's partnership work. So they didn't have to reinvent the wheel. They worked with someone to come together and create something, which was great. 56 Dean Street, which I'm sure we all are aware of, down in London, they're really I think the gold standard in terms of Chem Sex support. They really brought together a kind of more holistic approach and bringing sexual health support and drug support together to create something specific for Chem Sex users. So they've got a lot of resources that can help inform the services in Scotland of where we want to go to, what's the aims that we're wanting to do. And it's this the National HIV Nurse Association's conference. So this was a couple of years ago, and they were talking about how complex Chem Sex can be, but doing it in a way that's easily understood, so that nurses can feel comfortable in dealing with with clients that are coming to them for support. So it was a really good PowerPoint presentation and showing how complicated Chem Sex can be, the reasons why people are doing it, but it did it in a really nutshell kind of way, easy to understand and easy to kind of take away the information. So these are kind of some of the services that are available down south that are very specific to Chem Sex, because they've got bigger populations in their cities, for instance, and there's a lot to learn for our services in Scotland, and a lot that we can take off of these. So next. So this last quote really summed it up for me about chemsex. It's like you emerge from the closet expecting to be this butterfly, and the gay community just slaps the idealism out of you. You go from your mum's house to a gay club where a lot of people are on drugs, and it's like, this is my community. It's like the effing jungle, and understanding that is like that can be the experience of gay people going onto the scene the first time. Like I mentioned before, like Eddie Izzard said, it's the first step of knowing who you are, and experiencing the gay scene is really an amazing experience, but understanding that there can be harms from that as well can help guide younger gay people who are now coming out to find themselves without having to use drink and drugs to get over maybe internalized homophobia, internalized shame. So it's looking at that. This quote really summed up the reason of why people might want to use chemsex. I really was connected to it when I read it, and I really wanted to kind of put it in, because the information sessions that me and Lesley do together hopefully will help foster understanding and knowledge in it. And we're coming up to the end of our presentation, and I just want to thank you for your time. And if there's any questions that you guys have got, anything that me and Lesley have kind of talked about, please put into the Q&A. We'll definitely get back to you, and I'll pass it over to Lesley.
Yeah, just thanks very much, Stephen, for bringing us to the end of the workshop there. Thank you. And thank you for the people that have stuck with us and given us those little claps. It's very, very nice. The polls are now live. So if you have stuck with us, we would love it if you could fill in the polls. Our contact details are here. So yeah, please get in touch with either Stephen or myself, two of us together, to follow up. So I think Stephen and I are just going to drop our cameras because apparently it gets awkward if we stay on while the poll questions are up. So thanks to everyone for your participation.
Thanks, everybody.
Thanks, bye.